Good evening, everybody. Welcome back to COVID-19 Facts First on this evening of March 25th. Despite some impressive advancements, Cuomo says New York State still has a lot of work to do to contain the virus. In Monroe County, there are now 121 cases of COVID-19. 25 people have been hospitalized, and 15 of those have needed to go into the ICU. To date, there have been 3 deaths, none today. Monroe County has also released this map of where cases are concentrated. The sections here are based on zip code. You can take a closer look at this map over at rochesterfirst.com. A University of Rochester ICU nurse has tested positive for the virus. She lives in Hornell and is the 4th case in Steuben County. Kaylee Hamilton says what started out as a tickle in her throat and a fever eventually led to COVID-19. She is now under quarantine at home in Hornell with her son, who's also undergoing the quarantine to monitor for symptoms. She says that the support of her community has meant so much to her in this difficult time.
The outpour of support that I've gotten from the Hornell community has been amazing. Offering to drop stuff off for us, food, soup, medicine. They know that we can't go out, so the neighbors took out the trash for us. Just little things, but it means a lot because you don't realize how much you depend on being able to just leave your house.
There are more than 38,000 cases of COVID-19 in New York State. Of those, 3,800 people are in the hospital. Here's a closer look at the numbers. More than 5,000 of those cases are new, and more than 100,000 people have been tested. The state is working to decrease admissions into hospitals while increasing the numbers of beds available. Cuomo says we need to be ready for the apex of the cases when that hits.
That is the point of the greatest number of people coming into the hospital system. So that's our greatest load, is the apex. And when is that going to happen? Again, that is a projection. Again, that moves around. But the current projection is that could be in 21 days.
New York is also calling on all former or retired medical workers to help. So far, 40,000 people say they will volunteer their time. He says getting medical equipment will be pointless if we do not have the staff to use it. A wild ride once again on Wall Street today. Early today, the Dow was down more than 500 points, but it slowly recovered those losses and ended the day up nearly 500 points. And the race is on to find an effective treatment for COVID-19. Now, a drug that was designed to treat the Ebola virus could be helpful in treating the coronavirus. Researchers at URMC are hopeful, and they're looking into this themselves. They want to enroll 750 patients in a trial. The hope is that the drug could stop the virus from replicating. Dr. Angela Branch from URMC says she's optimistic the drug will work.
The drug works by stopping the virus from making more copies of itself once it's infected you. And so if the virus isn't able to make more copies of itself, then your body's immune or defense system is able to respond. And then the chances of recovery become much significantly improved.
For all the latest updates, be sure to keep it right here at rochesterfirst.com, as well as Facebook and Twitter. You can find our pages there. Thank you for watching, everyone. Have a safe evening.